What is induction therapy?
Yeah, so induction chemotherapy refers really to a type of chemotherapy that tends to be quite intensive, so strong chemotherapy that patients receive in the hospital setting. That induction chemotherapy typically requires a hospitalization of 3 to 4 weeks, sometimes a little bit longer, as the patient gets their treatment during the first week or so, and then they're recovering from the effects of that treatment during the next 3 weeks in the hospital.
Okay. What is consolidation therapy?
So a patient first gets induction chemotherapy. If they achieve a complete remission, so their disease goes away, that's great. We know their disease seems to be gone, but we also know that patients relapse. So if patients relapse, it means their disease wasn't really gone. It's just that we couldn't find it. It was hiding somewhere. So consolidation chemotherapy is chemotherapy that is given after a patient is in complete remission in an effort to kill any residual leukemia cells that may be hiding in the body that we can't see on our bone marrow biopsies, in an effort to deepen the remission that we've achieved during induction.
Okay. Are there any other terms that patients should be familiar with?
There are a lot of other terms that patients should be familiar with. I'll just touch on one because it can get complicated. We now have for acute myeloid leukemia a type of therapy that goes beyond induction and consolidation called maintenance therapy. Maintenance therapy is when a patient is done with induction, done with consolidation, and the question is, can you give them something that is easy to take, relatively non-toxic, that they can take for a prolonged period of time to also help prevent relapse? Maintenance therapy has been really a backbone of the treatment of a different kind of leukemia called acute lymphoblastic leukemia, which happens primarily in children for many years. Maintenance therapy is also now a backbone of therapy for a different kind of blood cancer called multiple myeloma. And very recently, only within the past maybe year to 2 years, we've incorporated maintenance therapy for AML for certain groups of patients.